The Board of Pensions serves 65,000 people through the benefits plan of the Presbyterian Church, USA. Partnering with churches and PC, USA affiliated employers, it provides benefits and programs to promote spiritual, health, financial, and vocational well-being. COVID-19 strains all 4 areas of well-being, and the Board of Pensions is providing guidance and support to employers and members during this crisis. Here, we are going to review how the Families First Coronavirus Response Act and the Coronavirus Aid, Relief, and Economic Security Act, the CARES Act, affect health plan coverage. The Families First Act eliminated co-payment requirements and cost sharing for COVID-19 testing, including testing that is not FDA approved. Some of this testing may have been considered experimental under health plans before COVID-19. Testing still must be medically necessary to be covered. Once COVID-19 vaccines are FDA approved and available, they will not be subject to co-pays and deductibles. Under the CARES Act, health plans and insurance companies will have to cover these vaccines as preventive services or immunizations. Coverage for a vaccine will take effect within 15 business days of the government approving its use. The CARES Act also temporarily eliminates co-pays and deductibles for telehealth services under high-deductible health plans. These plans must treat telehealth services as preventive for calendar years 2020 and 2021. This applies to all telehealth services, not just services related to COVID-19. Medicare coverage is also affected. Provisions of the CARES Act or adopted by the Centers for Medicare and Medicaid Services, CMS, provide for telehealth, including for virtual check-ins. COVID-19 lab tests are covered 100% under Medicare Part B. Medicare will cover any preventive tests, screenings, and vaccinations as they become available. The CARES Act makes payments for over-the-counter medications and medical supplies eligible for reimbursement under flexible spending accounts, FSAs, health savings accounts, HSAs, and health reimbursement arrangements, HRAs. Previously, a prescription was needed for reimbursement. This change is retroactive to January 1, 2020, and has no end date, at least for now. Administrators of FSAs, HSAs, and HRAs can provide participants with the updated list of medications and supplies that are eligible for reimbursement. The Board of Pensions partners with Further on these tax-advantaged accounts. The COVID-19 crisis has additional relevance for these tax-advantaged accounts, which employees use to pay for healthcare or dependent care expenses. Employers provide flexible spending accounts, or FSAs, so employees can set aside pre-tax dollars to cover healthcare and dependent care costs. FSA participants elect amounts each year when they enroll for benefits. The IRS now allows mid-year changes to these contributions throughout the year, but only under certain circumstances. Generally, circumstances related to COVID-19 are eligible for a mid-year change. Participants in healthcare FSAs and dependent care FSAs may change their contribution for any of the following reasons: a reduction in hours that causes a loss of medical coverage, a change in employment status, FMLA leave, a substantial change in benefits coverage or cost. Additionally, participants in dependent care FSAs can make a mid-year change if arrangements for care change, or if the cost of care changes. For example, parents who are working from home and not paying for childcare may make a mid-year change. Health savings accounts, HSAs, are employee-owned accounts for employees enrolled in high-deductible health plans, HDHPs. Participants may change their contribution at any time and for any reason. Employees can contribute directly to their HSAs if a termination ends access to payroll deductions, as long as they remain enrolled in HDHP coverage. Health reimbursement arrangements, HRAs, are employer-funded. Participants whose employment is terminated may submit claims for healthcare expenses up to the HRA termination date, or by any deadline the employer sets in its plan. In the case of a termination or reduction in hours, if an employee elects to continue healthcare coverage under COBRA or through a church plan, the HRA can continue to cover the expenses. Employees who lose healthcare coverage due to the COVID-19 crisis may enroll for coverage through the Affordable Care Act's health insurance marketplace during a special enrollment period. They do not have to wait for the next open enrollment period if they enroll within 60 days of termination. Employees who have lost wages but not their coverage may not enroll for coverage through the marketplace, even if it would be more affordable. However, some states with their own exchange marketplaces have created limited special enrollment periods for these circumstances. Employers and employees who want to know more should contact their state exchange. The benefits plan offers self-paid medical continuation coverage to members and eligible family when coverage would otherwise end. The Board of Pensions continues to monitor legislation and take every opportunity to support church and affiliated employers and employees who participated in the benefits plan of the Presbyterian Church, USA. We've just reviewed COVID-19 related adjustments to employer group health benefits. Now, let's talk about some relief the board is providing to employers. The board is offering dues relief for up to 3 months to small churches with fewer than 300 members and a single installed pastor. Other churches and employers may defer their costs of coverage for ministers and employees for 2 months, with deferrals being repaid through an installment plan. This is a time of crisis for PCUSA churches, employers, and affiliated organizations, and for ministers and employees who serve them. The Board of Pensions will continue to help support all who participate in the benefits plan.